Hello friends, this is Aparna and I'm one of the facilitator for INMOProfessional for mindfulness training. And at this time during COVID-19, it's more important than ever to embrace this mindfulness practice. Many of you would have already done this training with INMO either by calling the facilitator in person or by coming to the Richmond Center. But those who are not familiar with mindfulness at all, it is very important to understand what mindfulness is. So the practice of mindfulness comes from very ancient times and then it became scientific once Dr. John Kabat-Zinn learned these practices and presented to the Western world in a very scientific form. And Dr. John Kabat-Zinn defined mindfulness as paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. So every part of this definition is extremely important to focus. And why these practices are becoming so popular is because it reduces the stress, it reduces anxiety, and it reduces fear. That's why many multinational companies are providing this training to their employees. And healthcare professionals need it more than any other staff in any other organization. So when we look at the stress is created in the brain. There are two parts of the brain that we will focus on. So one is amygdala. Amygdala is the hind brain and it's called the alarm center. So amygdala activates fight or flight response by alerting us that there is a danger. And it is useful, but it only meant to last for a certain period of time. So it should be short-lived in order for this to be useful and to prevent us from any danger. But what happens when we are in a constant fear or in constant stress? Then amygdala becomes more and more activated and becomes in charge. And it suppresses our ability to see clearly in any situation. And it starts to affect our body, and our body falls prey to many psychosomatic illnesses. So at this time, when COVID-19 is causing a lot of stress and presenting many challenges for us as healthcare workers, we must let our executive area of brain, which is prefrontal cortex, the front part of the brain, take charge, and we must do some practices that will activate this area of the brain, because this area of the brain see things clearly, makes rational decisions, and help us to stay calm. There are many researches which have proven that amygdala becomes less active for regular mindfulness practitioners. Dr. Sarah Laser, she's a neuroscientist from Harvard University, and she scanned the meditator's brain before and after 8 weeks of practice of mindfulness. And results were amazing. Amygdala was far less active and also had actually shrunk. So this amygdala, which is responsible for causing flight and fight response and causing a lot of stress, starts to shrink in regular mindfulness practitioners. When we are present for our experiences, we are mindful. That means at that moment, we are neither in past nor in future, whereas we are where we should be. So if we are in work, we are present in our body and mind and in the work situation. How we can reduce stress in this very challenging time is by taking good care of ourselves, by taking mindful pauses during the day. So, the first pause is when you come into work. It's very hard to disconnect and be present in work. So, I would advise that it is a good practice when you arrive at work and when you're ready for your shift. Just take few conscious breaths and tell the mind that this is work time. That will help to disconnect from any worries and anxieties that we carry from home to work. Because it's not easy to be coming into work, and sometimes we are anxious that what if I catch this coronavirus and I bring it home to my family. But you're already taking all the precautions. So let this fear not overtake your presence, and be present in your mind and body by those 3 conscious breaths. So all you have to do is take a deep breath in fully and then blow it out. So breathing in through your nose and breathing out through the nose. And that's called mindful breathing. And then the second pause will be around the break time when you are halfway through the shift. And during that pause, just assess how the day has been and how the mind is feeling, how the body is feeling, and accept and acknowledge. If body is feeling tired, acknowledge that it is feeling tired. And don't be so harsh on yourself. So this particular time is important to again take 3 conscious breaths. And then the third pause will be at the end of the shift. When you come to the end of the shift, it is time again to focus on the breath and disconnect with what has happened at work situation, so that you're not carrying this burden of suffering home with you. And you're able to be fully present for your family members when you arrive home. So these 3 pauses and this mindful breathing is certainly going to help in staying present where we are rather than getting lost in our thoughts. And more than ever, it is important that our nurses, midwives, public health nurses, community midwives are engaging in mindful communication, compassion, and kindness. Because these are the qualities that are expected from us by general public. And all these qualities are present in us, but we need to be kind to ourselves first. So accept your own feelings and be kind to yourself. Don't always be critical about your own judgments, likes and dislikes. We need to practice compassion at this time. And compassion practice is not a luxury. According to mindful approach to COVID-19, there are ways to practice compassionate leadership is look, listen, feel, and respond. Check in with the energy level of your own first, and then check in the energy level of your team. And also look for what is not being said. It's the non-verbal communication. And listen, practice mindful listening. and feel, respond with kindness. So kindness starts with self, and then it can be uh, passed on to others. And respond. So when we practice mindfulness and we are present, then we do not react. So there are lot of anxieties, fear, and anger in the air. Patients might be complaining, but don't take anything personally. And instead of reacting, take a pause before giving your balanced response. So, I'm going to give you some practical tips on how to stay calm at this very challenging time. All you have to do when you start to feel that this stress is taking over, you'll be saying that how will I know that now the stress level is quite high, because we actually become good at what we do every day or what we become habitual of. So if you are in habit of remaining in stress and not doing much about it, then your body's level of stress tolerance is probably much higher. So it is important to tune in and check in with the body and know when the stress level is high. How you will know is that body will starts to kind of complain in one or the other way. And the mind will feel very, very cluttered, and there'll be lots of thoughts, and there is a kind of it's like unclear mind where you're unable to relax, or mind feels quite restless, body feels very kind of tight, and you might be holding your fist tight, or you're storing a lot of tension in this area of head and neck, because this is the part of the body where we store tension most. So it's important that during your break time, when you are at work, when you go for break, just beside eating food and chatting to others, at least dedicate 1 or 2 minutes for this practice, where you just sit down and pay some attention to the mind and body. So put your feet on the ground and relax your shoulders, and just take one conscious breath before you start to eat. And just take one breath in through the nose and out through the nose. So inhale in full awareness and exhale in full awareness. And it's very important, beside doing this breathing and checking in with the mind, it is important that we do some regular exercise. And when you go for green exercise, means you can even just be in your own back garden or front garden, or even in your work if there is a little area where you can walk. Then just take even 2 minutes to walk in the fresh air and look at the sky, connect with the sky, look at the trees and look at the leaves, look at the birds. Try and tune into the sounds of the bird, because every time you're doing that, you are present and you're bringing mind home to this body, because mind is like a vagabond. It loves to run around either in the past or in the future. But mindfulness practice teaches us how to be present in this body. And once mind and body are together, we feel at ease. Because the definition of disease itself says that there is something that is not at ease, dis-ease. So see how you can bring yourself to ease. And breath acts like an anchor. So you use your breath as an anchor to bring mind home to this body. So I'm going to just guide you for a very short breathing practice that will help you to stay calm and present in your body at this challenging time. So just stay in a dignified posture, sit upright, Take a conscious breath in through the nose and notice the breath coming in and going out. Follow the breath. Notice the rise and the fall of the chest. Notice the rise and the fall of the abdomen. See how when the breath goes in, the abdomen expands. And when we breathe out, the abdomen shrinks. And as soon as we engage with our breath, we activate our parasympathetic nervous system, which is the calming center of our body. And it calms us down instantly. So let's make use of this scientific knowledge and stay calm by using mindful breathing, looking after ourselves, and then when we are in good space and we are feeling healthy in our body and mind, we will be able to look after our colleagues and our patients by being fully present. Because the time is now. The time is always now. So let's do it together. Let's alleviate human suffering by staying present through the breath in our bodies and then being present for others who are suffering. Thank you so much for listening, and I really wish you well and hope you and your family stays well during this COVID-19 period.